Good morning, you're welcome. This is hashtag GTV Breakfast. Still to come, conversations on police officers suing the IGP for delayed promotions and matters arising from the Electoral Commission's press conference about the limited voter registration. But for now, we are talking about sex, or the consequences of things when that don't go quite right, and sexually transmitted infections. And the big one that we're talking about today is gonorrhea. And my guest is a family physician specialist at Medina Polyclinic, Dr. Emmanuel Asante. Good morning. Welcome to the show.
Good morning. Good morning.
What is gonorrhea?
Okay. All right. So gonorrhea is one of the sexually transmitted diseases, that commonly reports in our health facilities.
Mm-hmm.
I mean, globally. I mean, not only in Ghana. And it's that common that as at 2018, the CDC recorded about 1.6 million cases. Center for Disease Control. Yes, I mean, in 2018, out of that, we had ages ranging between 15 and 24 years old. I mean, teenagers reporting with gonorrhea. So
1.6 million.
1.6 million
worldwide.
Worldwide.
Yeah.
Worldwide. Yes.
Mm-hmm.
Yes. So commonly, we saw that ages ranges between 15 to 24 years. Mm-hmm. Teenagers tend to show up with the condition.
Is it strange that teenagers are getting gonorrhea?
Because I mean, these are age groups that are very sexually active.
Okay.
Yes. So basically, that is that.
So it's spread by sexual contact.
Yes, sexual contact. So one can contract it through, I mean, oral sex, vaginal sex, or anal sex.
Okay.
Yes.
How does it present?
Okay, I mean, so basically,
how do you know you have gonorrhea?
Yeah, so basically, it may present as asymptomatic. In other words, somebody may come without having any symptoms, but he may have it. But if the person will have any presentation or any symptom at all, right? One may have some foul, vaginal, anal, or penile discharge, right? Which can take the form of whitish color, yellowish, creamish color, or even a greenish color.
Wow.
All right. Yes, the person may complain of pain when he or she is passing urine and what have you. So yes, that is if you present with any symptoms at all.
And if it lies low, how long can it lie low for without presenting?
Yes, I mean, it can be there for a long time. I mean, there are certain strains of the germ or the bacteria which usually don't express itself, I mean, in the human body like that. So a lot of the time you may have cases where they may not present at all and the person may be living with it. However, the person can also pass it to someone else who he or she engages in any unhealthy sexual behavior with.
Is it passed only through sex?
Yes, basically it's a sexually transmitted disease, right? The other, ways that one can get it, I mean, it's very rare. I mean, people talk about maybe kissing, people talk about, I mean, using towels and all the personal items that, one can. The germ survives mostly inside the body. Outside the body, I mean, they hardly live for long. I mean, studies have shown that within 24 hours, outside the body, they are gone.
So people shouldn't be too concerned about catching it from like a swimming pool.
Swimming pools. I mean, yes. I mean, swimming pools, yes. Unless, I mean, one is having an intercourse in the swimming
pool.
In the pool,
okay.
Right? Otherwise, I mean, they hardly survive, outside the body.
What's the link between gonorrhea and, say, contracting HIV?
Yes, I mean, basically, if one is having gonorrhea, you see, the germ attacks the lining of the mucous membrane. The mucous membranes are the, soft lining within the mouth, within the rectum, anal region, within the vaginal region and all that. So in the process of time, sores and ulcers are formed along those linings. So if one is engaged in unhealthy sexual lifestyle and all that, right? And I mean, you are just engaged with anonymous people, a lot of people, and you can easily contract it, because then those sores within those linings becomes, the door for other infections, of which HIV is one of them. And we shouldn't forget that HIV is also a sexually transmitted disease, right? So one can easily get HIV and then infect the other part of your body.
Who's more at risk, males or females?
Well, I mean, studies have shown that both are at risk, but it's few studies that I came across that we've read, it tends to a little bit biased to women, right? Even though men too tend to at times also predominate, the prevalence rate.
Why are women more susceptible?
Well, well, I think it has to do with the lifestyle in terms of how they are easily found to engage in some of the commercial sex activities, healthy sexual behaviors and all that. And a lot of the time too, their presentation regarding the condition may be non-specific, right? And at times very mild. You may not even detect that it's gonorrhea, because then it may also mimic some other conditions, for example, urinary tract infections or other vaginal infections that are not sexually transmitted, right? So basically, those are the few things that...
What's the difference between gonorrhea and syphilis?
Yes, gonorrhea is caused by a bacteria called Neisseria gonorrhea. All right, and syphilis is caused by a bacteria called trachoma pallidum. There's another, a different bacteria altogether that causes syphilis. But both are sexually transmitted.
Do they present the same symptoms?
No. With syphilis, usually is more or less like discovering that you have a sore or kind of an ulcer, right, which is painless, on your genital area, all right? But there are different stages. We have first stage, second stage, and third stage of syphilis. But mostly, right, the person will come to you and present with a sore, on the genital area, which is painless.
Okay.
Right.
Does that mean that gonorrhea does not present with sore?
No, gonorrhea you will not see any sore outside the the area of infection a lot of the time. If there are sores, it's usually internal. You encounter it at the mucous membranes, in the mouth, right, in the urethra, or which is the tube from which urine comes from, right, and also in the rectal mucous area, and then the vaginal mucous area. Yeah, but it doesn't usually present on the outside.
Okay.
Of anything like that.
Are condoms effective in protecting one's
against
infection?
Yes. Condoms, it reduces the risk, but not completely. Yeah. So say yes. So we advise people that yes, it's a way of safeguarding or protecting yourself against that, but not completely, because then of course somebody may not use it well. Somebody may encounter situations where it bursts or it ruptures and all that. So not completely, but it reduces the risk.
How does one test for gonorrhea?
Okay, so basically for us in the practice, we say that if anybody comes to the hospital, we take the history. Apart from the history, we examine, we inspect, so that we get what we call the high index of suspicion before we even go for the test. All right. So some of the tests we do, we can take your urine specimen sample, right? We can take your discharge. If somebody comes and says, I'm having discharge from my genital or any orifice of the body, we take a swab. All right, we call them the endocervical swab, right, where we take samples from your cervix, which is the neck of the womb. We can take samples, from your penis, or how do you call it, your urine and all that. And then we run a test called nucleic amplification test, all right, NAAT, and then within 48 hours or so, we are able to determine that, yes, this confirms our high index of suspicion that the person is having gonorrhea. Because before then, we will be in the known that this is a person who is in a promiscuous life, maybe it's a commercial, because from the history, we found out about your lifestyle history, family history, and all that. So we'll be able to have that high index of suspicion before we even run the test.
So if you have multiple partners,
yes, multiple
prostitute,
yes, multiple partners, anonymous partners, and you are engaged in all that. Of course, you stand the risk of developing, gonorrhea. And sexually transmitted disease is not only gonorrhea. As you mentioned, we have syphilis, right? We have chlamydia, gonorrhea itself. We have HIV itself, right? And even all those hepatitis B and C all can be sexually transmitted.
There's a question about can white. So we have a condition called white in women.
Yes.
Can it Does it lead to gonorrhea, or is it a cause of a gonorrhea, or is it a presentation of gonorrhea?
Yes, so that's why I initially said that a lot of the time women tend to present with gonorrhea in a subtle form, right? Usually it's mild and non-specific, so one can easily miss the diagnosis of gonorrhea and think that it is candidiasis or candida albicans. Candidiasis, what you just mentioned, is candidiasis, right?
White.
Yes, white, what normally called is caused by a fungal infection, candida albicans. All right. So for a lot of the time, from the history, it's always, something different, and it's so much unlike gonorrhea. I mean, for it's white and it's non-offensive. It doesn't smell, all right? But with gonorrhea, a lot of the time, the person will tell that it's very offensive, and then, a lot of the history, supporting it is usually points to gonorrhea, so it's different.
Now, let's talk about treatment. What are the treatments for gonorrhea?
Okay, so once the patient is diagnosed, from the start, we counsel the person, right? We tell you about non-pharmacological treatment, and we tell you about the pharmacological treatment. So in the non-pharmacological treatment, you're interested in your partners. Once you've come with diagnosis with gonorrhea, let us also know about your partners, get them involved and get them treated, because they also may go out there and spread.
That would be very hard if you're a prostitute.
Yeah, exactly. Yeah, so confidentially, we try to, talk to them that if they have contacts and all that, they should get us in the know. And that is also the reason why we have education, like what we are doing now, and then also sharing some of this information on social media and all that, to get people who are in such healthy sexual lifestyles to get themselves tested. All right, get themselves tested. So with treatment, we tell you that there are medications for it. We have a medication called ceftriaxone. We give you, an injection of ceftriaxone, and you are good to go, right? Apart from ceftriaxone, we have other medications that if somebody is not comfortable with ceftriaxone, that is, if you have reactions, allergies to it, we recommend other medications like azithromycin, right? Plus gentamicin to be given to you. There's a condition called chlamydia. A lot of the time it's mixed with gonorrhea, so we also try to prophylactically approach it by giving a medication called doxycycline.
When you say prophylactically, what do you mean?
That is, we are not sure that you have that condition, but because we know that a lot of the time gonorrhea comes, alongside other sexually transmitted diseases, of which chlamydia is one of them, we give it to prevent it.
Okay.
Yes.
A couple more questions. Do you have any? Do you find that gonorrhea is becoming resistant to certain forms of drugs, certain form of antibiotics?
Yes, of course. So obviously that's why we advise against self-medication and all that, because in the process of time, the bacteria called Neisseria gonorrhea develops what we call inhibitory defensive mechanisms.
Break it down for me.
So it forms some kind of soldiers that are able to attack the medication and prevent the medication from entering into its cell structures. All right. Yes, in the process of time.
They fight the medicine.
Yes, they fight the medicine. So they develop, in other words, a protective shield or a cover, right, so that the medications will not have any effect. And these things happen when medications are abused. You don't come to hospital because maybe you read somewhere, you go and buy the medication and you use it anyhow.
How about self-treatment in Ghana?
Self-treatment in Ghana and all that, yes. So
it's a common
problem.
It's
a common problem. People go and then buy the medication without consulting the expertise and all that, without coming to the hospital. So in the process that the medication is abused, and with time the bacteria or virus or whatever it is develop resistance to it, and it cuts across. We initially talked about syphilis, right? The germ or the bacteria that causes it is different. It's different from how do you call it? The bacteria that causes gonorrhea. The syphilis is Treponema pallidum, right? And again, people take go and buy the medications on their own because they've seen a sore on their genital region and all that. And a lot of the time, yes, we develop that resistance antibiotic strains, all right. And then the medication does not work. Now we give the medication, the person still comes back to the same thing because then the germ has developed, or the bacteria has developed resistance, and it becomes a problem.
Becomes a big problem.
Yes.
What are the long-term effects of untreated gono?
Yes, so long-term effects. So we have long-term effects both in men and in women. All right. And again, we shouldn't forget that a baby can also get gonorrhea from the mother, what we call vertical mother to child transmission.
Oh, wow.
Yes. So that's why
no fault of the baby.
Yeah, there's no fault of the baby. So that's why we advise, effective antenatal care.
Is this at birth? The baby is born and the baby
Yes, the
has
person is
gonorrhea?
passing through the vaginal
the tract,
canal.
yeah.
Yes,
Oh,
yes,
boy.
yes. So
Wow.
so if you have a woman who does not come to antenatal clinic, so that's why antenatal clinic is so important, because when you come, we're able to detect all that. We're able to run those tests, and then you are good to go. So the baby is born with pus or purulent discharge from the eyes. Right, you see some discharge coming from the eyes, and the eyes are all, it can be swollen and all that.
Can it lead to blindness?
Yeah, if it's not treated, you can develop it. So we call it ophthalmia neonatarium, where you see the baby's eyes swollen, maybe redness and all that, and you see the discharge coming.
But it can be cured.
Yes, it can be cured. So we have medications that we put on the eye, gentamicin, cipro, and all that, of no fault of his or hers. So basically, yes.
And the long-term effects on the man?
Yes, the long-term effect on the man. One, if it is not treated, okay, you can develop what we call it. The bacteria can affect the tubes and the linings of the testes. All right, so your testes can get inflamed or otitis. The canals through which sperm run through to come out from the penis can also be infected. Epididymis, there's a strata that covers difference, can also be infected. Right, what we call epididymal otitis can also happen.
Bottom line, you cannot have babies.
And in rare cases, in the process of time, if it is not treated, you can be infertile. Which means you cannot have babies.
How about women?
Yes. So with women too, in the process of time, they may develop what we call chronic pelvic pain. They may develop what we call pelvic inflammatory disease. They may develop what we call Asherman syndrome, which is destroying of the structures in the womb. Okay, they stand the risk of developing extrauterine gestation, right? What we call commonly known as ectopic pregnancy, or any part of the genital system, all right? And in the process of time, if it's not taken care of well, the person can end up being infertile, cannot give birth. And it can spread through the blood, what we call disseminated gonosemia, or disseminated gonorrhea infection, all right? And when that happens, now the gonorrhea has spread to your joint. It affects the joints, arthritis. It affects the ligaments and tendons of the human body, tenosynovitis, right? And it can cause issues with the eye and all that. So it is important that once a person, knows himself or herself is that I've found myself engaging in any unhealthy sexual behavior and all that, don't wait till the symptoms show up, because the incubation period, the period by which the symptoms starts manifesting between 1 to 14 days. All right, you may see symptoms or you may not. But so once you realize that you've been involved in any unhealthy behavior, risky behaviors, come and let's test you out.
All right, a couple of questions before we let you go. Henry wants to know, does every discharge from the vagina indicate an infection?
Not always, right? So that is why it is important that once you have any discharge from the vagina, you come and we see, because like I said, we have sexually transmitted diseases, right? Like gonorrhea, chlamydia, syphilis, HIV, all those hepatitis B, hepatitis C, can be contracted through sexual intercourse. We have other ones too that are not sexual. It's just vaginal infection, like the candida that you mentioned, or white you mentioned, all right? And then probably maybe when one is pregnant, it may have some discharges and all that, okay? Which may be a normal, occurrence. So you need to come and see.
More questions from curious viewers. Do you only get a urinary tract infection from sexual contact only? Says Yao.
No. So of course, you see, with the females, urinary tract infection is very common in females because the female genital anatomy and then the rectal region is close.
Okay.
The genital region of female and then the rectal is very close. So if you use public facilities that are not hygienic, right, you go sit on it and all that, it's not clean, and there can be easily transfer of infection, right, not just into your vagina, but then into the urethra, the tube from which urine comes.
So this is a question somebody was asking. Joseph was asking whether you can contract gonorrhea by use of the toilet.
Yes, like I said,
it's rare.
It's rare. But it's possible. The bacteria, hardly survives for a long time outside the body.
Okay.
All right. But then if it's less than 24 hours, like I said, I mean maximum 24 hours of survival. But if less than 24 hours, and you get in there, and then somehow you find yourself using an unhygienic, you can contract it, but it's rare.
Very
I mean,
rare.
yes.
Okay. Can you have a situation of white being a normal thing for women? Is it normal?
You see, the white basically, like I said, is caused by a fungus called Candida albicans. All right, this white can be superimposed with other bacterial infection. Some other bacterial infection can also come in there to attack. You see, the female vaginal system in itself has certain what we call normal flora, kind of a bacteria which tends to protect its environment.
So good bacteria.
Yes, good bacteria, if you will, right?
Okay.
Protect its environments and then make sure that, it's kept safe. But then, if the person is having low immune system, if the person is abusing certain medications and all that, this bacteria can tend to also develop into another thing and will be causing problems.
So when you see white, you should just go to the hospital.
You can come to the hospital and let's see, because
Okay.
it can also have other infections adding on and causing you problems.
All right. Ifya wants to know, it's kind of tangential, but probably connected. How do you treat syphilis?
Yes. All right. So syphilis, too, like I said, is a sexually transmitted disease, right? Caused by Treponema pallidum, syphilis, right? We have other subtypes of syphilis which one can develop. We have pharmacological and non-pharmacological treatment. We have a medication called X-pen or penicillin, right? That we give depending on the stage of syphilis that you're having. All right. We give you a shot of benzyl penicillin, benzathine penicillin, and you are good to go, right? We'll tell you come in maybe in a month or 3 months time so that we will check again. But then syphilis, once you develop it, it can remain with you for life even after treatment, which would not cause any problem. The certain particles or structures of the syphilis will still be in your body. So there are times that we've treated the patient, you come, we'll check and it's still there, but it doesn't mean that it hasn't been treated.
But the sores are gone.
Yes, I mean we've sorted you out and you don't have those symptoms. But then the particles of the germ or the bacteria that causes that Treponema pallidum may still be there.
Okay.
Yes, but will not cause any problem.
Are there natural home remedies for gonorrhea?
Well, so that's why we talk about non-pharmacological treatment. Non-pharmacological treatment means non-medicinal. I mean, it has nothing to do with those orthodox medications that we normally prescribe. So we tell people, okay, if you are involved in illicit drugs, alcohol, which are things that can predispose you to living an unhealthy, risky sexual behavior and all that, we put a stop to it. All right. We tell you, eat adequate amounts of fruits, vegetables, exercise and all that. Okay. And we have certain alternative and complementary medicines, from maybe plants and herbs that at times people are so much interested in. Like we have things like garlic. It has antibacterial properties. It helps. Honey, it has antibacterial properties. It helps. Ginger has antibacterial properties.
But people should start eating ginger and honey after they've gotten the exposure, right? So yeah.
Apple cider vinegar, has antibacterial properties. They help. So these things, can also.
All right.
We tell people you can add on and they
okay.
help.
This is probably going to be my last question. Can children be infected by any means? Well, you told us that through birth, mother to child, that's vertical.
Yes.
But otherwise, no.
Otherwise, no. Otherwise, no. Obviously, unless maybe a pedophile or something.
Yeah. Wow. Yeah. Crazy.
Yeah.
Okay. Dr. Santi, what would you leave as a takeaway for those who probably just got in watching the show around this time and they want to take away from this?
So basically, as I said, gonorrhea is a sexually transmitted disease. One is the second most common reported sexually transmitted disease we have around, right? It may show symptoms or may not. All right. So we say that if you are a man, okay, you may or may not see symptoms, but then if you see symptoms, it may be between 4 to 5 days. A woman, between 8 to 10 days. All right. So if you know yourself that you've been engaged in any unhealthy, risky sexual lifestyle and all that, come to the hospital. Don't wait, right? Because the complications can be dire. And then when you come, we are able to treat you and then sort you. And then for primary prevention, right, we are educating you. Yes, we advise that you can use condoms and all that, but condoms do not completely take it away. So we advise that there is always a mutual monogamous, relationships, knowing very well that your partner too has tested for gonorrhea and is clean. Otherwise, you may be clean, but the other person, can cause you to have it.
Maybe they should add it for the marriage counseling.
Yes,
thing,
exactly.
Where both of you go do your gonorrhea test before you get married. But thank you so much.
Exactly. Thank you very much.
Dr. Emmanuel Asante is a family physician specialist at Medina Polyclinic. If you missed this conversation, just go to our YouTube, Ghana Broadcasting Corporation. Go to Facebook, GTV Ghana. You get this conversation there. And those of you who do night duty, tonight at 11:30 p.m., you will get a repeat of this broadcast. Bottom line, have safe sex.